Mastitis is one of the most significant health concerns affecting dairy farms. It can reduce milk production and quality, increase treatment costs, and negatively affect animal welfare and herd longevity. Early recognition, consistent record-keeping, and appropriate follow-up testing are essential for managing mastitis effectively. Welcome to HerdBook's Mastitis Decision Tool. This tool helps dairy goat owners organize mastitis screening information, interpret findings, and identify appropriate next steps. It brings CMT scores, somatic cell counts, clinical findings, AccuMast results, and formal culture results together in one dedicated workflow. The tool provides decision support, but it does not diagnose mastitis or replace veterinary guidance. The Mastitis dashboard provides a quick overview of recent herd activity. Summary cards highlight assessments completed this month, cases awaiting culture, positive cultures, high or urgent cases, and goats with recurrent abnormal findings. Recent assessments appear below the summary cards, making it easy to review or continue working with existing records. To start the decision tool, select New Assessment. This is the Mastitis Assessment entry form. Begin by selecting the doe being assessed. Only does who are currently in milk appear in the goat selector. The assessment date and time default to the current date and time, but both can be edited. When available, HerdBook also fills in the doe's lactation number, days in milk, lactation stage, and parity category. These may also be entered or edited manually. After selecting a doe, HerdBook searches for recent CMT and milk test results recorded on or before the assessment date. Here, I've selected Coco because I had entered milk test results and CMT results previously. She had a sudden rise in her somatic cell count, so I'll use the Mastitis Assessment tool to help with decision-making. The most recent CMT scores are imported into the left and right udder half fields. These values remain fully editable. For somatic cell count, the latest milk test is imported as the current SCC. The milk test immediately before it is imported as the prior SCC and used to evaluate the trend. If prior SCC or CMT results have not yet been recorded, they may be entered here. These entries will become part of the mastitis assessment record, but do not transfer over to the milk test results table or herd health events. Recording of CMT and milk test results have been covered in prior tutorials. The decision tool also takes clinical findings into account. Select the milk's appearance and note abnormalities such as flakes, clots, watery milk, blood, or discoloration. Then record any udder findings, including swelling, heat, pain, firmness, or asymmetry. Systemic signs such as fever, reduced appetite, or depression are especially important. With findings of systemic illness or abnormal milk or udder findings, the tool will recommend prompt veterinary evaluation, even in the absence of abnormal CMT or SCC test findings. When CMT and/or SCC results are imported or manually entered, the decision tool has enough information to suggest the next step in mastitis evaluation. Click the Preview Recommendation button to view the results. In this case, Coco had a rapidly rising somatic cell count as well as abnormal CMT, and the decision tool recommends a culture. These are often not readily available, and AccuMast or similar on-farm culture is a reasonable additional screening tool while awaiting results of a formal culture. Whether you choose on-farm culture or formal culture from a qualified microbiology lab, results are entered in the last two sections of the form. Results are recorded independently for the left and right udder halves. This is important because it allows for selective treatment of the affected udder. For each half, you can enter the result status, organism category, identified organisms, and notes. Fortunately, Coco's AccuMast cultures were negative, but I've entered a positive result here to demonstrate the change in recommendation with positive cultures. Clicking the Preview Recommendation button again changes the recommendation to a veterinary consult or formal culture. After all results are entered and the recommendations reviewed, click the Save Assessment button. To review an assessment, when speaking to your vet, for example, return to the dashboard by clicking Health in the main navigation bar and Mastitis Decision Tool in the drop-down. Hover over the assessment in question and click that row. The assessment may be edited or deleted, but be careful. Deletions cannot be reversed. HerdBook's Mastitis Decision Tool brings screening results, clinical observations, and pathogen testing information into one organized workflow. Use it to document findings consistently, monitor trends, identify cases needing additional testing, and maintain a clear mastitis history for each doe. Always remember that this tool provides decision support. CMT and SCC do not diagnose bacterial mastitis, and veterinary guidance should be sought whenever a doe shows systemic illness, significant udder changes, or other concerning signs.